guys. So June is Cataract Awareness Month. Ophthalmology Resident at the Mandeville Regional Hospital, Dr. Alicia Swaby-Spencer is here to tell us about cataracts, what causes them, how they affect our vision, and the treatment options that are available in Jamaica. She tells us the good news is that it's reversible. So she's here to tell us more. Hi, Doc. Morning.
Hi, morning.
Thanks for being here with us.
Thank you for having me.
You're super passionate about eyes, very much so.
Very much so.
Super passionate about glaucoma, you say, because it's irreversible.
Right.
But also super passionate about cataracts because you realize this can improve quality of life once we address, which is just to kind of remove it, right?
Basically.
It sounds simply. Let's talk about the causes. I mentioned to you when you came on set that it was last week in an interview that I realized that children get cataracts from trauma. I did not know this.
Very much so.
You said it's the #1 cause of?
It is one of the leading cause of cataract in children. Because they're playful, they interact with a lot of objects, they toss things. I had a patient recently who his brother was eating a chicken bone, and it was finishing, he threw the chicken bone at his sibling and it stuck him in the eye, causes a laceration and also cause a cataract. So the simple things that we take for granted can result in cataract. But like I said, the beauty about it, it is reversible.
What are the other causes that we need to know about?
There are many other causes for it. All of us are encountered experiencing that cause, which is age. So as we get older, the proteins in our eye, just as our skin changes, the protein within our eye changes, and it causes cloudiness within the lens itself and resulting cataract. Now, there are other causes such as diabetes. It is one of the many causes as well because the protein changes as a result of the high sugar levels. There are also medications. So we have steroid users, asthmatics who are on prolonged or chronic use of steroids. These too can result in
really?
Right, cataract formation.
We kind of jump the gun because some people are saying cataract. Some people hear the word cataract and they don't really know what it is, you know. So what is a cataract?
All right, so I like to use my eye baby, which I travel with a lot. So cataract, if we should open the eye, don't be traumatized. Within the eye, here you have the cornea, which is at the front. Behind it, what we see called the eye baby, the black area is the iris. And behind that is the lens. Now I just put apart some parts for simple demonstration. Now the lens is behind here, and what happens is that this is supposed to be clear at all times, but with aging and, as I say, trauma and chemicals, this transparent lens can become opaque, becomes dark, and as a result it blocks the light that's supposed to enter through the pupil from hitting the retina. I imagine it like your camera. If the lens on your camera becomes cloudy, the picture that you get becomes cloudy. So that's how cataract works. It's just basically cloudiness of what is supposed to be the clear lens.
Okay.
What are the early signs that we should look for?
So in the very early stages, it can be very subtle, simple things as glare. Say you're driving and the glare on the road is affecting you tremendously. That is one cause. Blur vision, of course. So you may notice that in looking in your visual field, you're seeing patchy areas that may seem dark. That can be a result of the cataract as well. There are some patients who may experience eye pain as a result of the constant straining or trying to see. The muscles around the eye become fatigued and can result in pain in the eyes and headache. With the constant straining as well, you may have watery eyes, so become burny and teary, and you have a lot of watery eyes.
Can you usually see it, Doc? Is it usually, can you? So
in the early stages, you may not see it by looking in the eye, but as it matures, as it gets older, it may appear whitish. So you're looking in somebody's eye and the center of it looks very white. That's usually in the later stages. We don't want it to reach there.
Okay.
You mentioned a lot of things in terms of diabetes and other things. Are those the age, NCDs, those are the people who are most at risk for cataract?
Most at risk, and also the smokers. So with the smoking and, well, your lifestyle in general affects every aspect of your health. So smoking most definitely causes changes within the lens and predisposes you to cataract.
All right, well, we started off on a good note.
Yeah.
Treatment options are available, and I'm so happy for that because I know, Simone, our grandparents and great-grandparents, this was not a good outcome for them.
Went blind.
Yes. Yeah.
If you should track the history of how cataract surgery was done, it was said that in the early stages, people used to just hit them in the back of the head with the hope that the cataract would fall behind and it will shift it out of position and the vision will become clear. But that's in the ancestral times, not anymore. It's very simple, minimal, invasive, and it is a easy recovery process. So you do the surgery today, you don't go to sleep, so that we don't put you to sleep, and you go home the same day, you're able to function just the same.
What do? You numb the eye?
Right. So
and then you just tell us what the process is.
So you have different type of patients. Some persons who can manage the local procedures. So for those persons, we lay them flat to sleep, clean the ear, of course. We put a shield over the face, so only the eye is left open with the shield. And then we have small, tiny instruments using a microscope, of course. We make a small incision where the white and the black ear of the eye would meet, and we pass the instrument inside. There are different ways we can do it, with ultrasound or with instruments to remove it. And then we just we'll take out the lens, of course, and replace it with an artificial lens.
Okay.
Bandage and you're home.
Okay. Wow. And healing is within?
Within 6 weeks, tops.
Okay. What's the relationship between glaucoma and cataracts?
They're scarcely related. However, one can induce the other. Cataract affects the lens, whereas glaucoma affects the nerve. Right. And our nerves are not easily regenerated, so glaucoma, as you know, it's permanent loss of vision.
Okay.
Wow. You have everyone's a winner 3K and 5K run this year.
Yes.
Tell me about that.
Right. So that is on Father's Day, June 21st. It will be at Hope Gardens, beautiful Hope Gardens. We begin at 6 o'clock. Donation is $3,000 to register. Everyone can enter. Family, elderly, from the young adults, we all can enter. And this is geared towards raising awareness to cataract, and also to help those who are visually impaired. So all the proceedings go towards Jamaica Society for the Blind. Okay.
In the meantime, in order to maintain good eye health and to check up on these bodies here, cataracts, how often should we be coming to, are we seeing an optician or an ophthalmologist, one, and two, how often?
So it is recommended that if you're at high risk of developing it, especially cases of glaucoma, you can start as early as possible. But it's usually recommended at the age of 40 to have your yearly routine eye examination done. You can either see an optometrist or an ophthalmologist. The optometrist will do the screening, and if they notice anything, then they'll refer to the ophthalmologist. Of course, the ophthalmologist is more in depth, in detail, make prescription, we do surgeries and the right medication. So that's what differs. But the optometrist can start the screening and refer to the ophthalmologist.
All right, thank you so much, Doc. Lots that we've learned this morning.
Thank
I
you.
hope our viewers learned a lot as well, and that eye health. There's some parts of the body that we are so concerned about in terms of health, but when it comes to the eyes and other parts, we don't give it as much attention.
Right.
So guys, do what you must.
And some persons avoid doing so because of fear.
Fear.
And it's nothing to be afraid of. It's better to address it, get resolution, rather than to sit and wait.
Yeah,
Absolutely.
good advice.
Ophthalmology resident at Mandeville Regional Hospital, Dr. Alicia Swaby-Spencer.
Girl Talk after the break.
Beautiful.
Thanks, Doc.